Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Alrighty, so first on the agenda is the review and approval of minutes. We actually had revised minutes from September. Did anyone have a chance to review those minutes? Anyone have any additions or changes or move to approve?
I have a few typos and word changes on both of the transcriptions of
On September as well?
Yeah, both of them.
Okay.
And I hoped I would do that today, but I couldn't. But I can get that into you and provisionally approve pending minor modifications. For the most part, they're okay.
Yeah. So should we, with those typo revisions, should we move to approve for the September? We'll start with that one.
Move to approve.
Great. A second?
Second.
Okay, so that's approved. And then for the October 20th, I did just, I'm sure one of yours was, Chloe's already updated it, pneumococcal vaccine. Babby was absent at the last meeting for her daughter's wedding. But otherwise, yeah, David, if you'll do your little typos, et cetera. Barring those changes, anyone else have any concerns about the minutes for October? Any move to approve? I'll move to approve. Any seconds?
Second.
Great. All righty, so the first thing on our agenda is organizational issues. So a few changes upcoming in the board. David is next month, has served the board for how long, 10 years?
8 years.
8 years, and so therefore must retire his position on the Radnor Board of Health. So next meeting will be his last meeting after 8 years. Seth is actually resigning his post after the December meeting as well. And my family is moving, so I am also resigning my position on the board and my position as chairman after the meeting next month. So I think I brought up many times at the meeting the Chester-Crozier health system and the lack of care in Delaware County. My husband was employed by the Chester-Crozier health system, so he subsequently had to find a new job. So we are moving to the Hershey-Harrisburg-Camp Hill area. Him very soon, myself in bits and starts. So, all right, so those are all these sad organizational issues. Maggie, do we have any more interest or have we moved any at all?
We have Melissa, who you spoke with, about ready to go.
Yeah.
And we have one more person who we haven't interviewed yet, hasn't been able to come in. So we have at least those two, and there might be a third.
Okay, excellent.
So how many spots does that leave that are open?
That will leave 4 spots, right? Because if Dave and myself and Seth are gone and we had 1 empty seat. So there'll be 4 spots. Yeah.
Lee, Aaron, you, Bob,
Yeah.
and Rice.
Yeah.
Which is enough for a quorum if everybody shows.
Yeah, true. And we have some interest, and hopefully, I kind of wanted to announce that as well this month so we knew and inform everyone about Seth as well, so we can maybe see if you guys can move on that.
So I'd just like to say that this will have a sense of being highly disruptive, almost cataclysmic, but it's also opportunity.
Mm-hmm.
And the opportunity is to take a board that has a history and reshape it for the needs moving forward. So opportunity, challenge.
Yeah, so Dave and I have been very influenced by the people who ran the board before Dave, and I was very much influenced by Dave and Alex, and so I think new leadership will be great because we'll be able, they'll be able to kind of move things in the direction that they're interested in. So those are our organizational issues. Important health dates, just wanted to remind everybody that something very close to my heart, November is American Diabetes Month. About 10% of the U.S. population is estimated to have diabetes, and about 1/4 of those people are not aware that they have diabetes. So screening is very important, and so many treatments, so many new treatments for diabetes, definitely something that can be managed. It's also COPD Awareness Month and Lung Cancer Awareness Month, both of which frequently go together. Just something for community to be aware of. I'm not an expert on this because I'm not a primary care doctor, but there are recommendations for lung cancer screening these days, unlike in the past. I guess remote past when I was coming out of training. And the screening is a low-dose CAT scan of the chest. It's recommended for people who are ages 50 to 80 and have a 20-pack year history of smoking. So what you do is you take how many packs per day times the number of years. So if you've smoked 1 pack a day for 1 year, you have a 1-pack year. If you've smoked 10 packs a day for 1 year, you have a 10-pack history. So recommendation is if you have a 20-pack year history, ages 50 to 80, currently smoke or quit within the past 15 years, it's recommended to have a screening test. And that screening test is actually recommended every year until you're past that 15-year point of having smoked. So just wanted to kind of bring up those things for the month of November. Let's see. Oh, another thing for organizational issues, I just wanted to thank Roberta Winters with the League of Women's Voters, because she contacted me about programs that students have done for them and have prepared, and asking if that would be something that our board would be interested in providing to the community. And we do have one of those presentations scheduled for at next month's meeting. I think that'll be great. So next we have Dave with Communicable Disease Update.
Thank you, Madam Chair. I'd like to start with a non-communicable disease update, because there was something quite alarming that I noticed published in JAMA just this past week, and that was that, I'm not sure everybody knows, that the leading cause of death between birth and the age of 24 was motor vehicle accidents. Which is alarming in and of itself, especially when I see what's going on our roads. In the past year, data up through 24, in the 6 to 24 age group, it is now firearm violence, which is, to me, even more horrifying and alarming than having motor vehicle accidents killing more kids than anything else out there. But it's also a testimonial to the value of vaccines in the prevention of disease and the absence of murderous diseases in our pediatric population. So, two sides of the coin. Moving on to communicable diseases, at this point, there are no outbreaks to report of either flu, COVID, or RSV in the United States. But I'd like to start with flu, because it's really hard to get U.S. data, because there is no longer an MMWR. There is no longer a functioning CDC. The CDC has a site that on last Friday posted that there's nothing to report on flu activity, except prior to that, earlier in the week, there was a report of a new outbreak in the UK of a pretty hideous H3N2, thank you, H3N2 strain that has 7 mutations from the H3N2 that was included in the vaccine. So I think if you have family or friends that travel in the UK, they should be careful, and you should be careful. The state health alert notices posted some things. They recommend vaccination for flu, COVID, RSV, and pneumococcus for healthcare providers, long-term care employees, and people who visit long-term care facilities on a regular basis. That's a fairly new recommendation. There is an outbreak of infant botulism in contaminated formula. There have been multiple outbreaks, including botulism, and I can't remember what the other organism was, in raw milk. We've had the raw milk discussion. It's just, it has risk. You make your decisions, but there are raw milk outbreaks. And finally, pertussis had, last year from November through January, had largest outbreak in memory. There has been nothing happening yet, but this would be the time of year when you would expect to see that. And that's what I've got for you.
Can I add to that?
Yes, of course.
The botulism cases, the botulism cases are in 23 states right now, including Pennsylvania. And the formula product is by Heart Whole Nutrition Infant Formula. So if you know anybody who's using something like that, it should be marked "Do Not Use" and dispose of properly. Just to be out, looking for that.
I think that's great information. I would not necessarily rely on the notion that all the ones that are packaged under that one brand may not be everything coming out of the factory where contamination occurred.
Correct. No, that's true.
You just don't know that.
You have to look
And
for
it
that.
was a voluntary recall that By Heart did. They
Yes.
really only had they had a minority of the total cases. So it's out there somewhere else. And they were just generous enough to pull everything in
Yeah,
because
that's
they had 13 or 18 cases that were By Heart associated out of 60-odd, 70-odd cases.
Yeah, voluntary recalls are what do they call it? An anomaly. They pretty much had their arms twisted, I'm sure.
I'm sure, but
But you're saying that otherwise they haven't determined what other,
that's right. So
what
it's
else is
out there, and it
contaminated?
wasn't all By Heart associated.
got it,
But it was the only formula company that did a
Voluntarily,
recall.
that had enough and voluntary, had enough cases associated, yeah. Okay. I will say that the Pennsylvania Department of Health still does have some information out there, but they're not releasing, it's not real timely. I think, they have like a respiratory virus dashboard, but the last time it was updated was the 8th, so 8 days ago. Yeah, and it's also kind of very non-specific. It's like 1,000 laboratory confirmed influenza cases have been reported, but
But
Where
Babby
in-
shared with me that pretty quiet in her shop, and
Yeah?
she gets the report that from Villanova that it's pretty quiet there.
Yes, true. I've never worked fall this quiet, never. We're usually very busy.
Yeah.
Very quiet.
the PA website says visits for RSV, COVID, and flu to ERs are all very low. So that's pretty unusual for beginning of November, until they're not, but so far so good. So far so good. All right, anyone have anything else they wanted to add for our communicable disease update? Okay, excellent. Now we'd love to have the opportunity. Next on the agenda is for the student interns, give a little bit of update with Babby and Bob as far as projects and how things are coming along. But we know it's obviously very early in the year.
So I'm doing my research project on the connection between sleep and academic performance in adolescence. And so far I've looked a little bit into the connection between later school start times and student health. As we know, Radnor High School recently moved their times back. And I'm also planning on interviewing an adolescent therapist practicing in Bryn Mawr to further my research.
I've begun to narrow down the main objectives of the research I'm preparing to do, particularly revolving around the recent public services to the elderly that have been disrupted by the government shutdown. I'm looking forward to possibly collaborating with a couple different agencies in the region.
Out of interest at Wayne Senior Center, is that one of them? Okay, excellent. Yeah, because they're very much enmeshed in the community, easy to approach. It's wonderful. Anyone have any questions or thoughts about projects at this point?
No, I think thank you both for doing this, and we're looking forward. I know Bob and I are looking forward to working with you, and it's just going to be great projects. So, and Haley, you're at Radnor, right? So.
Yeah. Both are. All right, so next on the agenda, we had old business. We had at our last meeting, we had the public participation about the replacement of the carpet in the Radnor Township building. I did write up a little statement, but I did not send it out to the board, so I would like to do that before we decide if we want to vote on it, and I'm not sure where things stand with finding a contractor for that.
Bid's not out yet.
Okay. All right, great. I was wondering about maybe just us recommending this wording is seriously, I wrote it down, between two patients. This maybe is not the exact right wording, but perhaps saying like the Radnor Board of Health would recommend the township take into account replacing the carpet in the administration building in the most environmentally sustainable way while taking into account financial considerations. Just kind of after seeing the information that was presented by the public last meeting and kind of looking into myself as far as environmental concerns, I think that is something that we should recommend as members of the community and as on the Board of Health. I don't know if anybody had any other thoughts about that. I can kind of send out the statement and we can vote on it next meeting as an official recommendation.
So Maggie, has the RFA gone out on that?
No,
So a report from the board might be helpful in formulating the RFA.
that's right. And helping them, discuss options with the carpet people.
Yeah,
The
so
carpet
I was
guys.
thinking if I could be a little more specific about what those because they didn't read the articles, and hear
Right.
the presentation. So kind of like, these are the concerns about the replacement, and these are the things we'd like to be taken into consideration when you're determining.
Now, I have not reviewed the agenda that will come out Wednesday. I do that tomorrow. We
Okay.
set that. I don't think it's on there, but sometimes they surprise me. So I will email you expeditiously if it is on there, or pull it
Okay,
till the next meeting.
excellent. Thank you, Maggie. All right, so new business. We have our Radnor School District update. Carrie, I don't know if you have anything that's been coming up health-wise at the schools.
Yes,
But that's
yes.
usually when we give you the opportunity to give us an update.
Yes, thank you. I reached out to our nurse coordinator, Mrs. Maureen Lorario. She's housed at at Archbishop Carroll, oversees all of our nurses in the district. We are not seeing a flu outbreak at this point. We had one case of reported at Wayne Elementary School. It's just been the common cold that we're seeing, a couple GI issues. There's been a few cases of mono at Radnor High School, but as you know, in all of our schools, we have signs, about, proper hand washing, when you're not feeling well, please stay home. And that goes out into our Radnor reader as well to our parents to ensure the health and safety. We're coming up on the end of our first quarter as we approach the holiday season, along with our trimester at the elementary school. So things are running smoothly so far. Things are down, and like you said, until it's not, but we'll continue to monitor, and our nurses get together quite frequently and talk about trends and meet, so we have a good support system for them.
May I ask a question?
Yes.
What is, which you might or might not be able to answer, what is the overall population of students and of staff in Radnor Township School District? Just to have
Okay.
a denominator against which to work when we talk about what you
Right,
what
I
you see.
think, I was just looking at these numbers the other day. I think we have about 3,500 students. Don't quote me. I don't have the right number. And probably at least, with all support staff, 1,000 between, including teachers, paraprofessionals, bus drivers, custodial, food. So we're still a fairly small district with the 5 buildings.
Thank you.
All right, next we have an update from Maggie from the Board of Commissioners that I think you've already given us a lot of updates.
Well, I've
but,
given you some.
Thank you.
It's been a busy couple of weeks, but you'll still have me sitting here as your liaison to the Board of Health after the election. The carpet issue, we've already discussed, and we've already discussed Board of Health candidates, which I said we will get Melissa going. You'll have a quorum even without her, I believe. You'll have 5. But that means everybody would have to be here, which is usually not the case. So we need to get that going, and I'll see if I can't push forward the one candidate I know of that's in the back, and I don't know, there might be 2. And then the other thing, and it's going to come up, I believe, Monday night at the Board of Commissioners meeting, is the introduction of the e-scooter, e-bike ordinance. We're going to have a bunch of Boy Scouts there during that meeting. We'll get a little bit of their input, which will be interesting, because this is basically saying e-scooters have to be on private land, not in the parks, not on the roads, not on the trails. And helmets are recommended. And e-bikes have to follow bike rules, and again, not on the Radnor Trail and not in the parks. And 16-year-olds and to adulthood have to wear helmets. And there's, of course, a whole enforcement part and whatnot, so.
I imagine that'd be a little controversial. I don't know if
It's
other-
controversial even amongst the Board of Commissioners.
Okay.
A little bit like dogs.
It's a little bit
Like
like
the
dogs.
dogs,
It
yeah.
actually has the same feeling, David. You know, this has increased my awareness so much of this issue. The other day, in a light sprinkle, I saw a mother with a maybe 6-year-old on the back on the edge of King of Prussia Road with an e-bike, and a littler kid on an e-scooter on the sidewalk. King of Prussia Road, imagine. Anyway, life-threatening. And I see kids all the time on e-scooters without helmets. So, and they're going 20 miles an hour. You know, it's a scary proposition. So,
So my initial-
it's not going to be a popular ordinance, but I think we'll get it passed.
So my initial comments were relevant then.
Mm-hmm.
Thanks.
That's it for me.
Thanks, Maggie. My update from the county is, you know, of course, they have their meetings every other month. If you look at the website, they have a lot of updates. I just kind of pull out like what interests me, so that's what I did from their last meeting, which kind of goes into communicable disease update, but I did want to remark on it. So they gave an epidemiology update. And an interesting thing was that there was a higher percentage of cases of sexually transmitted diseases, including chlamydia, gonorrhea, and syphilis in Delaware County compared to other counties in Pennsylvania, right? So Delaware County higher than other counties in Pennsylvania. Now you could be like, okay, makes sense. We're right outside the city. We have a higher population, et cetera. Then what they do is they take that and they compare that to Philadelphia and they compare it to Chester County. And so lower number of cases per percentage of people in Delaware County compared to Philadelphia, but higher compared to Chester County. So, you know, both of us kind of right outside of Philadelphia. I mean, Delaware County is a bit more populated than Chester County, but just something to think about and realize. And they did have things by zip code listed as well. And you bet 19087 and 19085 there were a bunch of cases. So just something to keep in mind. I know I've mentioned it many times. It's not that convenient for this area, but if anybody kind of works down toward Yeadon or Media, they do have kiosks that you can get swabs to test for chlamydia and gonorrhea, and you self-drop it back off. There's no charge associated, so that's a great use. I'm sure the health centers at the colleges also have access to that testing. So just something I thought was interested in looking at that.
Could I add one more thing that I forgot? I just didn't write it down, so it wasn't in my brain. We did have a representative from the Delaware County Planning Commission come and speak to us about and David, you jogged my memory talking about car accidents, their Vision Zero Delco, which if you want to look at it, it's the last Board of Commissioners meeting. It's right up front, a presentation on the steps that they would like us to all to go through to decrease fatalities, pedestrians, bicyclists, and car related. So it's quite interesting. We just received it electronically, so we're looking at it to potentially sign on to that.
a little bit off topic, but wanted to bring it up. I'm very thankful for the Board of Commissioners for those, the poles with the things hanging down for the railroad, where we would have all the railroad strikes and then the road would be closed off. It's very interesting because those things hanging are frequently flipped up over the top. So you know, if somebody had not flipped that out over the top, they would have gone through the bridge. So
We've
there would have
had,
been a strike.
when they first had it, it was a bar.
Yeah.
And we did have one bridge strike with that system, but since they've had these big hanging reflective PVC pieces of pipe, basically, we haven't had an active bridge strike. I interestingly had a pretty large party, and the people that delivered the tables and chairs and all that stuff said they were following their, I don't know, they didn't say what app, but their road app, and they hit the thing. And they said otherwise we would have plowed right into the bridge. So it's been a really good thing. Right now, they're flipped over, unfortunately, on the Matson Ford side.
Yeah, I mean, I live right there,
Yeah.
so it's like, oh,
I drive
look,
it every
okay.
day,
Yeah,
so
every so
Public
often,
Works
once
comes
there was the entire bar flipped over,
Yeah,
but that was
yeah.
pretty infrequent. But
Well,
you
the
can tell
bar
it's
had
working.
that plastic chain, and it would break.
Yeah.
This is a better system in that there are 4 independent hanging things. So it seems to be very effective, which is a good thing, because they were some pretty devastating accidents.
Yeah, and I hadn't realized like how many signs there really were until you had mentioned it and I started looking. I'm like, oh my gosh, there's like 6 signs on either side that people just don't even notice. But
People
those
don't
hanging
look up
things,
and read
the
signs.
hanging things,
The
yeah, they
hanging
notice.
things make a noise,
Yep.
pop them,
Yep. So
and they're fairly inexpensive to replace.
okay,
'cause they
good
do
because
break
they
up,
need to
yeah.
be replaced fairly often.
And thank our Public Works for doing that.
Yeah, that's great.
Yeah.
All right, so now we're to the public participation part of the evening. Do we have any members of the public that would like to speak?
This is spontaneous, based on what you were telling me. Diana Pope on Windermere Avenue. So in talking about communicable diseases, one of the ones you were pointing out, not the respiratory ones, but a childhood vaccine preventable disease, pertussis, right? I just think it'd be a great idea to put it on the record that you would recommend vaccination. That's all. That wasn't stated. That's all.
I've recommended that vaccination
Yes, I'm
17
sure you
times,
have
and
at many
I'm
meetings.
happy to endorse it again.
But whenever you mention it, it's also an issue, I believe, for people in my generation, isn't it? For young kids. So it's always worth saying it again.
You have new babies new babies in the family. These days, I've found when any of my nieces had a new baby, they insisted I show evidence of the DTaP or Tdap.
Terrific. Okay, thank you.
Yeah, I think new parents are pretty aware of that. And if they're declining, they know they're declining.
I am a very big proponent of the Tdap, and I worked in pediatrics for 5 years. And the problem with that, I think, is the acellular form. I have 3 kids who are fully vaccinated. All 3 kids tested positive for pertussis. My kids are grown now, and that was probably 10 years ago. And I worked in Radnor School District at the time. I subbed for them as well. And I said, I know these guys all have pertussis now because I just know what to look for in my own children. And I said, let's swab them to see. And my kids were positive, and it was just like, what? But, now they're recommending getting a Z-Pack even if it's been more than 2 weeks. So at that time, they did nothing. But I feel like that's always been a problem. I feel like when we talk to pediatricians and we see kids in that age group, we're always looking at that acellular form of the Tdap. So I think that's something that has to be looked at. Just my opinion on that. And we see it all the time at Bryn Mawr, we see pertussis.
And I think if you're in a particular risk category for pertussis or influenza, there are good drugs like azithromycin for pertussis, but there are several good drugs that mitigate the course of influenza if you are unfortunate enough to come across an asymptomatic or otherwise individual and get flu. You might want, if you're a high risk, you might want to consider having a course of Ofluza available so that you can start promptly when you have symptoms.
Anyone have anything else they would like to bring up at the meeting? All right, so we'll have a little.
Advertised, there are going to be seats on the Board of Health
Yes.
to other professionals that live in the area, so.
Maggie, are you looking just for, are you looking just with physicians and practitioners and nurses? What, or do you want nutrition?
We've had, no, nutrition would be fabulous. We've had insurance-related people in the past, because sometimes that comes up, really health care related, a big umbrella.
Yeah, because, I mean, coding is very important right
Yeah.
now. We're seeing Medicare pushing back with coding right now. I was just talking to a friend of mine who codes for mainline health systems, and they're not paying for some of the COVID and flu being given on the same day. So we're seeing that being pushed apart. If it's not coded separately, some of them are coming back. And I think the public needs to know that.
Yeah. Thank you.
Great, well, we'll have a very full agenda next month because we'll have a presentation, so we'll end a little early this evening. Anyone want to move to
Move to adjourn.
adjourn? Thank you. Second?
Second.
All right, meeting is adjourned.